take a couple minutes, and if you'd like to do so now, feel free to go ahead and unmute yourself and introduce yourself to the group. Joan.
Hi, I am Joan Painter with Seedco. We are a nonprofit connector entity for Maryland Health Connection, and we oversee 10 counties, 7 along the Eastern Shore and 3 in the Tri-County southern area of Maryland. And we are going in our 12th year of working on the program and have numerous navigators and assisters through other organizations that we partner with. Thanks.
Thanks, Joan. Happy to have you here. Any other work group? Lisa O'Boyle.
Hi, I'm Lisa O'Boyle. I'm a sales manager for small group over at Care First. Sitting in to cover Consumer Direct as our other Consumer Direct is out on PTO. Lisa Barrows asked me to join, so hopefully I'm helpful. But thank you all for inviting us.
Great, thank you, Lisa. I'll follow up with you after, but thanks for stepping in and thanks for joining. Any other members that didn't introduce themselves last meeting, last call? All right. Oh, Kara. Yes, Kara, please introduce yourself.
Hi, I'm Kara Chang. I'm with Optum. We were originally QSSI before we were purchased by Optum. I work on a CMS program doing fraud, waste, and abuse analytics. But before that, I did work on exchanges about 10 years ago. And I also am a public health student at Dartmouth College. So I really enjoy improving the user experience and quality improvement projects. So when I found out about this work group, I really wanted to join and learn from it. So hopefully I'm helpful too.
Thanks so much, Karen. Welcome. Glad to have you. I think that is it. Feel free to jump in if I'm wrong, but otherwise we'll go ahead and get started. One other thing I'll note before moving on, we had a change in co-chair nominations. I know I had sent out a survey to vote on co-chairs and the work group charter. We're just going to go ahead and do all that administrative stuff here really quickly before we get started. So for co-chair nominations, we have Robin Elliott nominated, who had introduced herself last meeting. And then we have a new co-chair nomination, Lisa Skipper. So Lisa, would you mind just reintroducing yourself to the group and just share your affiliation and a little bit about your background again?
Sure. Lisa Skipper, and I am a navigator through the Maryland Health Connection. I work at Mountain Laurel Medical Center, which is a federally qualified health center up in the far west region of our connector entities, the far west, and I'm up in Garrett County. So I wanted to be part of this group so that I could be a voice for the consumers that I assist, since we live so close to West Virginia and we have some issues there. So thanks for having me.
Thank you, Lisa. Thanks, Lisa and Robin, for stepping up. I think we can go ahead and get started. Thanks, Becca, for letting everyone know too. This meeting will be recorded. Just a standing reminder that we record all meetings simply for note-taking purposes. The meeting is now being recorded. Quick run through of our agenda. I'm gonna provide some more content review from the first meeting just so we can go over some main points and see if there's any outstanding questions. I'll also spend some time, we're gonna do a quick walkthrough together of the MHC plan shopping tool, just so everyone has the base understanding, especially for those who maybe aren't as familiar with the plan shopping tool. We'll do a walkthrough together really quickly today in addition to the content review. And then we're also joined by our Deputy Director of Marketing, Maggie Church is here. So she's going to give an overview of some consumer user experience testing that MHBE conducted last year and should hopefully provide some really helpful context for the group as well. And then we'll conclude again with an open discussion at the end, and we'll do some final priority setting before we get into the more focused and heavier discussions at our later meetings. So getting some administrative items out of the way first, we have a few things that we need to vote on before getting started. The first item is the July 31st meeting minutes from our first meeting. We did have one small correction that I wasn't able to send out. The minutes said Standing Advisory Committee at the top of the page. They should say Consumer Decision Support Work Group, so we've corrected that. Again, those were sent out yesterday. So aside from that small update, if anyone has any other comments on the minutes, let me know. Otherwise, I will move to approve the minutes from the July 31st meeting. Could I get a work group member to second this motion?
I'll second that.
Thank you. Unless I hear any nays, we will consider these minutes approved. You can either raise your hand for nay or unmute yourself. All right, hearing none, I'll consider the minutes approved. The next item is to vote to approve the work group charter. So I sent that out yesterday as well. If everyone's gotten a chance to review it, with that, I will move to approve the Consumer Decision Support Work Group Charter. Can I get a second to this motion?
I second.
Thank you. Any nays? Okay, hearing none, we'll consider the work group charter approved. Last item, final item is voting on co-chairs. So I'll go ahead and unless we have anyone else who'd like to put up a nomination, we have our 2 co-chair nominations that we just went through. I will move to approve Robin Elliott and Lisa Skipper as the Consumer Decision Support Work Group co-chairs. Again, if there's any other nominations, you can say so before I ask for a second to this motion. Hearing none, can I get someone to second the motion?
Second.
Thank you. Any nays? All right, we will consider Robin Elliott and Lisa Skipper confirmed co-chairs for the work group. Thank you both so much. And that is it for all of our administrative stuff today. All right, so I'll try to be as brief as I can. I did want to give some content review from the last meeting, and I'll mix this in with a live walkthrough of our plan shopping tool as well, just to level set as much as we can with work group members before we really get started on these deeper discussions. So again, really quickly, just a reminder about our current MHC plan offerings. For 2024, we have 4 on-exchange carriers, and we have a total of 44 plans that are available to consumers to plan shop for. So just wanted to keep these numbers in mind as we're thinking about the consumer experience and what it's like to navigate this number of plans that are available to them. We thought it also might be helpful just to really quickly review some coverage requirements for marketplace plans, most of them pursuant to the Affordable Care Act. So the first set of coverage requirements that all marketplace plans are required to include are called essential health benefits. These are a set of 10 service categories, all that have been termed essential health benefits. The 10 are listed below. These are all required. Generally all the specific coverages or the specific services that are covered under each of these 10 categories can vary. They vary by state and by state requirements, but this is kind of a general 10 list of services that are required to be included in all health plans, specifically all health plans in the individual and the small market. So that would include all of our on-exchange plans. So we have our essential health benefits, these list of 10 major service categories. And then the second kind of set of requirements are specifications for coverage of what we call preventive services. So preventive services they were that last category in that list of 10 essential health benefit categories. The Affordable Care Act also requires that all private plans cover a range of specified and recommended preventive services, and plans cannot impose cost sharing for anything that is considered a preventive service. So the list of preventive services includes things like routine care, routine health screenings, immunizations, checkups, things like that. I've linked the full list of preventive services if anyone's interested in looking through them, but these are very specific requirements that all plans are required to offer, including all the plans that are offered on exchange. So just wanted to review this really quickly. Coverage requirements, just as more food for thought for when we're thinking about the information that we're presenting to consumers, what information is important to present, and considerations for how we might share this and educate consumers on this during the plan shopping process, and whether or not we're doing this already or if we could be doing it better. But just wanted to level set and share that as more kind of food for thought. And then there were a couple questions that were asked at the first meeting that were interesting. We couldn't provide the information right away, but we found some of it. So just wanted to share a couple graphs with you. The first one, a member had asked about what types of assistance consumers are using when they enroll in health plans through the Maryland Health Connection, which was a great question. So we have data on that. I included a graph to the right from one of our monthly data reports from January of this year. We have monthly data reports on enrollment data, and a lot of it includes information about how consumers are enrolling in their health plan. So I'll give everyone everyone can kind of look through it, but I'll just note, you can see from the graph, the majority of consumers who are just re-enrolling in a plan. So consumers who are enrolled in a plan and are just re-enrolling in the same plan do so independently through our consumer website. For new enrollments, which are those blue bars on the graph, many more consumers are using in-person assistance. So we still do, there's around a little over 20,000 new enrollees who still did use the website independently. But for new enrollees, 20,000 were assisted by brokers, around 11,000 were assisted by our call center, and then over 4,000 were helped by navigators. And then just one other note, the most common method of assistance for changing an existing plan, so a current consumer who's trying to change their plan to something different, the most common form of assistance was through brokers. So I just wanted to give a little bit of information on that question that was asked at the last meeting. And then there was another member at the last meeting who asked if we had data on what type of device consumers are using when they're navigating our website, and whether there's any challenges that maybe come from using a mobile device for a consumer when it might be easier to use the desktop. So we have data on this as well. You can see the majority of users are accessing our website through a desktop, but there's still a significant number who are using mobile devices like smartphones or tablets, which maybe could present challenges versus using the desktop. So I'll note too with this graph, it was an interesting question, and this graph doesn't quite get to the root of that when it comes to plan shopping, because this data indicates how many are actually just visiting our website versus how it doesn't go into information about who's plan shopping on which device, right? So it's really just website visits on this graph versus what's actually going on. How are people accessing the plan shopping page? But it was still interesting information, so just wanted to share. And then just wanted to revisit the purpose of the work group and remind everyone, why are we here? So the work group purpose is to discuss areas to improve consumer decision support during the plan shopping experience, mostly with our Get an Estimate plan shopping tool, which we'll do a quick walkthrough in just a moment, and also through our MHC application, which is set up very similar. So again, we know there's a lot of consumers that really do still struggle with choosing a plan that fits their health and financial needs. And And this is really essential to address because it's important for consumers to not only enroll in health coverage, but to also be able to understand how to choose a plan that really fits their needs and provides the coverage that they need based on their healthcare usage. We also want to make sure that we are helping consumers understand all the financial assistance that's available to us on our website or through our marketplace, which based on data that we've analyzed and that we looked at last week, we're really seeing that there seems to be a significant number of consumers that aren't maximizing the financial assistance available to them, mainly in the form of cost sharing reductions, which are only accessible through silver plans. There's a lot of individuals that based on income we can see are available for these higher value silver cost sharing reduction plans, but are enrolled in either lower value plans like a bronze plan or gold or platinum plans when again, they could be receiving more bolstered assistance through cost sharing reductions through a silver plan. So in general, we're just interested in recommendations for how we can help consumers navigate financial assistance and then how we can help them navigate how to choose a best plan for them. I listed in this slide the running definition of underinsurance, which is really what we're getting at with the first kind of scenario that I described, where an individual with medical coverage still faces a lot of cost barriers in a way that's similar to as if they were uninsured when they're choosing a plan that just doesn't fit their needs and coverage requirements, especially for individuals that have higher healthcare needs and higher healthcare utilization. So I'll stop there. I think we understand the purpose and why we're here. Really quickly, again, these are the expected outcomes of the work group. We've kind of parceled them out into 3 areas of where we're hoping to have discussions for and get some, targeted recommendations from this work group to improve our plan shopping process. The 3 areas being identifying areas where consumers may benefit from more information or guidance as they're plan shopping, improving our plan information display, both on our plan list page, and then when consumers are using that side-by-side plan comparison tool. And then ultimately, we're interested in this work group providing recommendations for how we can ultimately provide tailored plan recommendations to consumers through our plan shopping tool based on the information that consumers provide us. So with that, I'm going to walk through everyone really quickly through our plan shopping, get an estimate tool. It'll be really brief. I'm not going to go into, exploring all the details and features of our tool, but I think it'll just be helpful to do a very quick walkthrough and help level set with all the work group members here. And then after that, we'll go through kind of a review of the literature review that Hilltop gave at the last meeting, and it might provide more context after we've walked through the plan shopping tool. We'll discuss best practices and decision aids that we believe MHC is currently using, and then we'll do a review of best practices and decision aids that MHC is not using based on what we understand of our plan shopping tool. So this is the landing page for Maryland Health Connection. When consumers click the Get an Estimate tool, I'll stop sharing my screen and we will navigate to the Get an Estimate tool. All right, can everyone see this?
Yes.
Yes.
Great, thank you. So when you click on the Get an Estimate tool, a consumer lands on this page. This is kind of the intro page where they're inputting their information. A best practice is keeping this as requiring consumers to input as little information as possible before they get to the plan shopping page. So we have very simple information. We ask for a zip code, plan availability changes depending on your geographic location. We ask to input the coverage year. We'll get the consumer's age. They're asked what type of coverage they're looking for. Are they planning to shop for health, dental, both? For this example, we'll choose health. There's some information on this first landing page about household information and what kind of information you need to input when you're adding spouses or other dependents, depending on who's seeking coverage in your household. So there's the option to add more information, add more dependents or spouses in your household, same way that you would for the primary applicant up here. And then this is a required field too, your estimated household income. We've made this a requirement for consumers on our tool to input because without sharing income information, there's no way for us to be able to estimate financial assistance that a consumer may be qualified for. So we've made this a required field. So I'll put in 35,000. The last piece of information on this page is explaining how consumers calculate their income to put onto this page. I won't go through it, but those are kind of all the pieces of information that are required and that we provide on this first initial page. Then when you click on Browse Plans, you land on this page. Robin, do you have a question?
Yes, on that first page, I had two questions. Under dental, is that triggered by, I guess the person putting it in is going to be an adult. So this isn't, sorry, I'm just thinking out loud through. Of course, we've got pediatric dental as part of the EHB. We are conveying to an adult whether or not they want to purchase separate dental coverage.
Yeah.
Yeah.
Good question. Yeah. So yes, the primary applicant is always going to be an adult. And for everyone on this call, for some context to this question, adult dental is not considered an essential health benefit. It's not considered a preventive service, so it's not required to be covered in a health plan. And I believe adult dental is not covered under most health plans. However, pediatric dental is required to be covered under all health plans. So there's that, little caveat of, pediatric dental is required, adult dental is not. I'll leave that there for now, Robin. I think that's a really great question, but that is something that I can note of whether or not we need to educate consumers at any point about what's covered, and especially with dental, making sure that consumers know dental is more than if it's not covered by your plan, you do need to sign up for a separate dental plan.
Mm-hmm. I know it's complicated and you're trying to keep probably this first one simple. But yes, and I see a question in the chat, just if you could click on the drop down box once more so that we could see.
Yeah, thanks, Shelly. I'm not sure why it's not showing up on the screen. I'm clicking on it now, but it just doesn't seem to be showing up for you guys. So when I click on this, select the coverage you need drop down, the coverage options are listed in order: health, dental, health and dental, or no coverage. So those are the four drop down options.
Okay, thank you.
Sure thing. Sorry, I don't know why we can't see it on the screen. Any other questions on the first page? Again, this is an initial run through, but what we'll do is in the next meeting in 2 weeks, we'll probably focus on this page of kind of discussing it in more detail.
Just a quick, an additional quick question. There's a question about pregnancy, and I understand why that question is there. What does it, and I saw an asterisk, I think. What does the consumer understand that mean, why that question is there?
That's a great question. I'm wondering if anyone else on this call, MHBE staff, has more context on that question.
Is it because it's a mandatory text field? It looks like you have zip code, country, coverage year.
And
You're
age.
referring to the asterisk.
Yeah, I think that's what it means.
Does it also have to do with the healthy babies for at least checking if you're Medicaid eligible?
No, so it doesn't inform any of the additional eligibility. It's just to show that it is a required field. So you have to select either yes or no for each household member.
So by adding yes, it increases the size of the family and it increases the size of the benefit.
Household, right? If you are.
Correct.
So
Thank you.
I'll just want to maybe later we can in a future meeting talk about different ways this question might be perceived.
Yeah, I think we'll make a note of that and maybe get more context on that question, as well as, you know, depending on why it's there, are we presenting the information in a way that consumers understand why they're asking that question? Yeah, I think that sounds good.
Great, thank you.
If I can add something here, since when I do enrollments, because we do work with this a lot, and if someone is pregnant, then as you said, it changes the income status. So even if it's just a couple, but the wife is pregnant, or the one member of the household is pregnant, then they become a household of three. And depending on where the income falls, they may be eligible for Medicaid while they're pregnant.
Yeah, all good
Yeah. So
points.
just to clarify, Amelia, I just wanted to clarify the asterisk is there just because it's a required question, but your answer to that question does inform whether or not you're eligible for Medicaid, or depending on your household size, that will change. But the asterisk is there just specifically because it's a required field.
Thank you, Nicole. I think that's a very succinct overview of this quick discussion. I appreciate it. I will definitely make a note if this is on this page, at least if that's something that maybe should provide more information to consumers on, because it's, you know, it's an important question to answer, and for consumers to understand why they're answering it. I think we could certainly make that a discussion point at the next meeting. So I'll make a note of that. Are there any other preliminary questions about this page? Yeah, Joan.
I'm surprised that the see if you qualify for financial help does not say gross wages, salaries, and tips. It does say net for self-employment or business. And when people don't understand that it does include gross wages, they're entering what is not an accurate number for this shopping estimate. So I would recommend a change to that.
Okay, that's a great point to make. We can absolutely include that in the list of specific items to review. This will more than likely be a topic of discussion. Of the income section is really confusing, and while it's not critical during this plan shopping process specifically to estimate, you know, correctly, that does happen in the actual application. You know, we could certainly be doing more to make sure that we are presenting income information very clearly, because calculating your income is actually confusing. And when you make a mistake in your income calculations, it can have ramifications if you receive too much financial assistance, especially come tax time. Again, it's, you know, this is the plan shopping page, but I think that we could very much look into, are we presenting this income information in a way that is understandable and the most helpful for consumers just getting started with plan shopping. Thanks for all the comments on this page. I think, Kara, you just wrote in the chat, curious to know the purpose of the no coverage option. Does that provide value to users? I'll make a note of that question. We will revisit that next time. We've captured all this information. So thank you, Kara, for that question. And we'll make sure to revisit that at the next meeting when we're discussing this more. All right, I will continue going through this. I think we'll probably end up spending a little more time just reviewing this plan shopping tool. We're in discussion now, so if we cut into discussion at the end, you know, we can move the agenda around, and I think we're just going to have a discussion now. So you click on browse plans once you've entered that information in that first page. Oh, actually, I'm going to have to go back and change the settings. So we'll go back, looking for health coverage. When we click on browse plans to view health plans, the consumer is then directed to this next page, which gives an explanation based on the income that they input in that first page, what financial assistance they qualify for. So it breaks down whether or not you are potentially eligible for cost sharing reductions based on the income you provided, the amount of premium tax credit that it's estimated you qualify for, again, based on the income that the consumer input. And then it estimates the amount of state premium assistance from the young adult subsidy program that MHB operates, that in addition to premium tax credit, a consumer would be eligible for. So it lists all the financial assistance estimates of what consumers qualify for. The consumer does have the option to shop for plans without cost savings. However, if you just click browse plans, we'll get to the plan shopping page after this next question. But when you click browse plans, it'll end up calculating that estimated premium assistance into the plan tile display for each plan to show the consumer what their net cost for each plan would be based on how much financial assistance they're estimated to qualify for. So this is the next page. After you click browse plans again, we have some disclaimers about health information, expected cost for members, kind of breaking down how you estimate your healthcare usage and kind of giving an idea of estimated costs based on what you expect your health usage to be. So this is an optional question. A consumer can either skip this question or if they'd like to input their estimate for how much healthcare utilization they expect for the year, they can do so. We have 3 options, low, medium, high, and it gives a breakdown of kind of examples of, when you have medium healthcare usage, that's usually consists of 5 to 10 visits from a healthcare provider, 5 to 10 kind of prescriptions throughout the year. It just gives examples of what low, medium, and high usage is. So let's say we chose medium usage. We can then click next and we get to the plan shopping page, which actually has all the plans that consumers can start shopping for. Every time you get to this page, the first disclaimer, this will always pop up that asks consumers to, let me just check, Diana, you have a question. Diana, did you actually just want to say it out loud?
Yes, my apologies. Thank you so much for your forbearance on this. So I think this is such a critical piece because I think this is where a lot of folks get hung up on. And, in terms of just what type of coverage is the most suitable for them. Like, I think we had some folks talk about at the last meeting about how, they get calls halfway through the plan year being like, I didn't realize that I got a bronze plan and I actually needed XYZ. So I think this is such an interesting page that the fact that you can skip it kind of makes it a little bit, makes it interesting to me, but also the fact that, this might be the meat of the discussion when you're talking about consumer decision support, because you're really trying to distill these complex actuarial things for a layperson to understand and like risk suggestion and stuff like that. So this is like, I don't know, if in my eyes, this is like the meat of the health literacy discussion right here.
Thanks, Diana. And just to confirm, you're talking about the prior page where a consumer is asked about their healthcare usage with the low, medium, and high responses.
Correct.
And the fact that that is optional versus.
Correct.
Got it. Yeah. Making that a required question. We can also look into what other states do. From what I remember, we've looked at how other states operate their plan shopping tools, and I don't believe anyone includes healthcare utilization as a required question for consumers before getting to plan shopping. But I agree. I think it's something that we can focus on and definitely dive into more. Thanks for that. Shlomo and then Robin. Shlomo, go ahead first.
Hi, everybody. I just wanted to bounce the idea that was just brought up. I think that page is very confusing, especially for the younger, healthier general crowd. And then they end up having, a hospitalization, whether it's they break a leg, whether they go in for pregnancy related stuff, where they consider themselves a low health user, and then they get hit with these bronze plans and they get thousands of dollars of of deductible costs that are being charged to them. And it's very misleading because they consider themselves a very low or medium used person. And then in reality, it doesn't have to do with if you go to the specialist every single month. It has to do with what your expenses will be. And that's very confusing to many.
Thanks. I think that is a really good point. Total cost estimates and estimating healthcare usage it's difficult to do. And making sure that we are providing the best and kind of most comprehensive, but at the same time, simple explanation is, I think that would be another good point of consideration. So we'll make sure that that's noted too. But thanks, Shlomo, for pointing that out. I think that is a really good point. Let's see. Robin, do you want to go ahead?
Yes, kind of just building on this discussion. I think even the page before this, when it talked about the different financial kinds of support, this gets right into financial literacy, and it's so complicated, and you all have done such a great job at trying to untangle this. Just noting that it still may not be that understandable to some people, because what are tax credits, what is financial help, and then the other thing and you all may have considered this, I'm just wondering if there's something to think about, like a way to convey this information verbally on a website where you, and I'm not a consumer literacy expert, but just thinking you have somebody kind of give an example of who they are and what might work for them, as another tool for people that this may be too dense of information to read, which, by the way, I include myself in that. It's a lot of information here.
Yeah, I agree, Robin. And I'll say too that I had a huge learning curve getting into the insurance world. So that's usually how I explain it to people, is I'm in this field and I find it confusing. So while I think we've done a lot of work to, consider how we present information, but that's definitely why we're here, is there's always room for improvement. And, especially from a larger stakeholder perspective, from your guys' perspective, what do you see as working? What do you see as confusing? What's your understanding of the consumer experience that maybe there's room for improvement in how we present information? And noting too, I think it's a great point about video tutorials that was mentioned. I believe Carmen Larson, our workgroup member here, had mentioned the idea of video tutorials and helping with explanations that way. So all good points. I think Seth, your hand was raised next.
Can you guys hear me okay?
Hi, yes, go ahead.
Yeah, going back to the low, medium, and high page, other websites that I use in day-to-day, like Health Sherpa, they actually give like an illustration, a little bit better example. So like, for example, if you say you're a 55-year-old male, when it brings up the low, medium, and high questions, it'll actually say like for low, 0 doctor visits, 4 prescription drugs, 1 lab. For medium, it'll say maybe like 2 labs, 1 specialist visit, 18 prescription drugs. And in this example, for a high individual, it would say like 2 hospital visits, 2 doctor visits, 5 specialist visits, and maybe like 44 prescription drugs for someone that's maybe a little bit older and may need to use more of their health insurance. So more illustrative example, maybe a little bit better to kind of help people, especially like if they're younger or older, decide maybe between low, medium, and high for recommendation.
That's interesting. So you're saying Health Sherpa tailors what their explanations of low, medium, high are based on age of consumer, if the consumer input that information.
Correct. Yeah, it changes from like a 23-year-old to a 55-year-old, and then it gives kind of a little bit better example of what high, medium, and low are in this case.
That's interesting. Thanks for that. That's a good example of something to consider. And then Joan and then Tom.
Yeah, and thanks, Robin, for bringing this up. The terminology here is very much internal. As you know, navigators working day in and day out with consumers, either in person or on the phone, we add on at least 2 sentences to these, and they're in plain English. So I was thinking, if the plain English can't be used right here, to have a link so you could click cost sharing reductions and get a better explanation of what that entails. I don't think people really understand this terminology as well as they could.
Yeah, I would be inclined to agree. I don't know if you guys will be able to, oh, this one's popping up, but we do have, right, these pop-ups, these info signs where you can read more of an explanation on what all these terms mean. So again, for the next meeting, I think our game plan would be to go through these initial pages that have all the pages where consumers are inputting information, their personal information, their healthcare utilization information. This page that is kind of a preliminary overview of financial assistance, and just take a really deep dive into this first section of the plan shopping page. And to Joan's point, how we're presenting the information, recommendations for maybe ways that are more consumer friendly, and get to the, educating consumers in a way that empowers them to understand health insurance concepts and then choose good plans for them.
Yeah, I think even people who only use the website and do not contact anyone to discuss information about health insurance, they may not even be clicking on these little information tabs. I mean, most people would be looking for a direct link or an easier explanation here on the top. And quite often our experience is that people have self-selected plans and they're just not the right plans. But that often comes too late.
Yeah, appreciate that perspective. And we've observed that on our end too. It's always unfortunate to hear that it's happening, kind of more widespread than we would hope it would be. But what I'll end up reviewing some more examples of other marketplaces and what they do for each of these pages. How are they presenting this information? And so we'll hopefully be able to go through some more of that at the next meeting and maybe provide some comparative examples of other states and how they present that information, and then get some more information from you all and your experience and workarounds that you've been able to come up with that maybe better present the information to a consumer and help them understand. All right, I think, Tom, did you still have a question? I believe your hand was raised before.
Yeah, I was thinking we have the low, medium, and high. What if you added a 4th if you have an unexpected medical event? Okay. And maybe you could have then a broken leg, appendicitis, something that could happen, and maybe there was an estimate of what that would mean out of pocket, so that you can show somebody, hey, look at if you're healthy, but if you break a leg and you have a bronze plan versus a silver plan, there's a big difference in what you're going to pay out of pocket.
Yeah, I think that's, I mean, getting back to Shlomo's point, that I think it's a really good point of something that it would probably be good to break that down a little further so consumers fully understand what healthcare utilization is. It's not just low, medium, high. There's accidents that happen, there's unexpected costs. So I think those are points well noted.
Thanks.
All right, we'll move on real quick. I'll just click next and we'll get to the plan shopping page and we'll review this super quick. Again, this is something that we will go into a lot more detail at future meetings. So I'll just give a really, really brief kind of overview walkthrough of some of the plan or the website features on the plan shopping page. So we have this disclaimer again that pops up every time you get to this page. It breaks down meta levels, gives a little bit more of an explanation, some other disclaimers to consumers. And then when you close that, here we are at the plan shopping page. So plans are listed. We can talk about auto sorting and filtering features that MHC has when we get to this page, but we just won't go into it now because we'll talk about it in a lot more detail at a future meeting. But here's an example of a plan tile on MHC. So this is an example of one plan. This is the first one that consumers are going to see with the information that I input. This is the information about a plan that is displayed to the consumer. It's the same for each plan. So when you go down, they're sharing the same information about each plan. We have our estimated monthly premium here, information about deductible, out-of-pocket max, and then we have some information about some more common services and cost sharing related to that. There's a lot of information on this page. Again, I'm not going to go through it now, but this will be kind of like the second focus area of our discussions is these plan tiles. How are we presenting this information? We have links to a lot more information. Is it organized right? Do the things that consumers value and kind of look for the most in a plan, do they stand out enough? Can consumers digest this information? There's just a lot of questions that we definitely want to look into more when we're thinking about how we're presenting this plan information. So these are the plan tiles. I'll go quickly. Here are some filter options that consumers can use. They can filter by meta level, different cost expenses. They can filter by health insurance company, the estimated monthly premium. We have a filter option where consumers can filter to see only value plans, etc. And then we have sorting options as well. So it looks like you can't see this, but the consumer can sort by, they can sort plans by annual deductible, by out-of-pocket maximums. They can sort by their estimated monthly premium, which when we're calculating net premium with all the financial assistance available, the plans would sort by net monthly premium. And they can sort by a couple other things like health insurance company, meta level, etc. So I'm going to stop there. I don't think that we have time to kind of look at how our plan comparison page is laid out, but we will do that again at a later meeting. Consumers can click up to 3 plans that they can compare side by side. So when they click a couple plans, they'll be able to do that. And we'll go through our plan comparison page and how that's laid out as well. But for now, I'm going to leave it there. Are there any other thoughts, initial questions on the plan shopping page before we get back to the a little more content review? Please feel free if you want to read your comments from the chat. For some reason, I'm just having trouble viewing it on my computer, but feel free to say anything out loud. Otherwise, we'll note the chat information as well.
Amelia, is there a way for folks to identify whether their doctor which plan their doctor currently is with?
Yeah, good question. Yes, we do have you can find a healthcare provider. So when consumers click on this, they can search for a provider to check whether it's covered under a plan. I believe what currently happens, so if you put a certain provider in the plan, you find them and you check them. When you go back to this page, the plans that are displayed will actually be auto filtered to only include plans that list that provider is covered under that plan based on our up-to-date information on providers. So I could be, I'll maybe want to double check with my team on that, but from my understanding, that's how it currently works. So you can check by provider, but maybe we need to discuss a little bit more how we do that and then how the plans are displayed based on when consumers check for that.
Amelia, if I can add to that, what I have found is this piece is, and this is one of my concerns on this piece, because it is not always accurate, because it will put in that there are only certain area doctors that accept it, and then when the consumer contacts their doctor, they find out that they do not take it or they're out of network. So I don't know how to fix the piece, but that is concerning on my side.
Yeah, I hear you. And I think we should we'll add that to our running discussion list. I agree it's important. And I know other marketplaces are having these conversations too, because it's a pretty regular complaint that, if a provider directory is not updated and a consumer thinks that a provider is covered under a plan, that's a pretty serious issue. So I'll make a note to include the discussion about how we search healthcare providers and whether or not maybe we need more disclaimers to consumers about, while we show this listed as a provider is covered under this plan, it's important to check and make sure that that provider is covered under that plan before selecting it.
Agree.
Thanks, Lisa.
Mm-hmm.
Anything else before I stop sharing this and we can get the rest of our content review out of the way? Okay, so with that, I will go back to the presentation. We did have a little more that I was going to walk through with you all, but I think just for time's sake, let me go ahead and pull this up. All right, so getting back to it, thanks everyone. I think that ended up being a helpful discussion just to do it while we were going through the plan shopping tool. So appreciate all the initial feedback from that. We did have some more slides. This is mainly a review of the literature review that Hilltop provided at the first meeting. Their literature review went into research on best practices in marketplace plan shopping and best practices in decision aid tools that are used. So I was gonna do kind of a quick run through that information, but I'll skip that for now. You guys have the slides, but we essentially just compiled a list of decision aids that we see, we know MHC currently uses, and then I've provided a couple slides that summarize all the evidence-supported decision aids that Hilltop found in their literature review that MHC is either not using, or maybe we consider how we better use them. So again, I'm not going to go through these. I want to give Maggie some time to give her presentation as well, but I'll send these slides out at the end of the meeting, and they just give a list of some of the stuff that we're talking about, or some of the information that was presented in the Hilltop Lit review of decision aids that we are not using, or maybe aren't using to the fullest extent. So with that, I will end my talking. I'm going to pass the mic to Maggie, our Deputy Director of Marketing, who's on call with us today. She's going to do a presentation on the consumer user experience testing that MHBE conducted last year. We do consumer user experience testing every couple years, the last one being for this 2023 open enrollment. So Maggie's going to give an overview of that and specifically the key findings that we found for the plan shopping experience when consumers got to the plan shopping portion of the consumer user testing. So Maggie, I'm going to go ahead and hand it to you. I can run the slides for you, but welcome and take away.
Yeah, thank you, Amelia. So yeah, that's right. Every other year we do user testing, usually during the open enrollment period. And we try to do it in the beginning of open enrollment. So November 1 through November 15th, this testing took place for 2023. And participants share their screen and then they explore health plans and they enroll or re-enroll. And let's see. So GoTo Research does the actual testing for us. And we try to get a mix of English and Spanish speaking users to better understand usability and behavior. We aim for a split between new enrollees and current enrollees, a mix of participants on the desktop and the mobile app, and a mix of ages between 18 and 64, and then also a mix of family compositions, individuals, partners with kids. And then the next slide. We also want a mix of counties, race and ethnicities, education level, gender. So all our English-speaking participants had at least some college education, and most of our Spanish-speaking participants had some college education. That's a little bit about the group. Okay, next slide. And then I'm just going to talk about plan shopping. The consumers spend about 90 minutes to 2 hours going through the enrollment process with us. So plan shopping is not their whole experience, but that was what we were going to speak to today. So let's see, several improvements have been made since we've been doing user experience testing throughout the last 4 or 5 years, or 4 or 5 user experience every other year. We've added filters, we've added the comparison tool, the drug and doctor search, which we were just talking about, and all those have really resonated with users. Next slide. There's still some areas that need improvement though, and when comparing plans, the yearly cost estimate was shown. I don't know if you could tell when Amelia was showing the tile, but there was like a yearly cost estimate, and I think some users really like that, but they're not sure how it's calculated. You can roll over it on the tooltip on the desktop version, but not on the mobile version, and people don't always understand that they can do that too. And then on the mobile version, there isn't really an explanation of how it's calculated. So that's one example where we could use some improvement. And some users notice the filtering tool, but others don't. And I think that's a very big benefit to users, so we want them to be able to use it. Okay, next slide. So here's an example. The user here selects plan costs and benefit, this bottom left red square, thinking that they'll see the complete list of costs. But really, it opens a PDF that's general information about the insurance carrier and what they're looking for, the actual costs and details, is in this button called Details. So that's one way where we could modify how we name things. Next slide. So the Spanish participants did not use the tooltips available on mobile or the desktop. And then as you can see here, the costos and beneficios, same thing, like it opens up a PDF in the background, and so mobile users weren't really sure what that opened, and they were thinking they were going to get to see the costs and the benefits, and they don't. Also, this PDF is in English, so that didn't really help our Spanish-speaking users. A lot of the layout for Spanish too, if you look at these on mobile, you can see that the titles are cut off because the words are just longer, and so they can't always see the whole description. And then we also found some nuances with Spanish speakers, that one of our participants wasn't familiar with a virtual plan, and so an unlimited $0 virtual as the name of the plan was confusing. Also down here, oh sorry, go back one. Also down here at the bottom, sort, filters, estimated tax credit on that second mobile screen. They're hard for users to see. There's just a lot of information on this page, and it's just hard for them to go through all the information, see those, and use them accordingly. Okay, next slide. And then during this testing, one participant, oh wait, this is talking about the cropped off slide too. So this is more about what I was just talking about, the cropped off headings and things like that. Okay, you can go to the next slide. So during this testing, one participant had filtered for PPO, and the HMO plans were still coming up. So I don't know if that's kind of what you're referring to, Lisa, like if users are actually clicking on a filter like for a doctor and it's still showing the wrong ones, but that's what one of our users had experienced. So the filters are not always working as they should. And then the next slide. So I think overall, the type of users coming to shop for insurance health plans ranges from novice to experienced. And the main thing that they're looking for is they want to know the difference between plans so that they can make the right decision for them. And the Spanish shopping experience, we have decided needs a lot of improvement. We've also talked a little bit internally about creating a video that would maybe help someone go over the various costs of health insurance while they're shopping. So what do they mean and how they relate, and maybe including some glossary terms there. And then pointing out some of the different drop-down menus, highlighting the different buttons in different ways so that the filters, the compare button, the tax credit draws the user's attention to these, and it's a little bit easier to navigate. So those were the main slides about plan shopping that I had to contribute.
Maggie, I think.
Yeah, questions? Comments?
Yeah, opening up for if anyone has anything they want to ask Maggie in particular. I'll also know too, Maggie will be on these calls. So as we're going through a lot of this information and there's questions about, was this included in the consumer user testing? I'm sure Maggie will be able to speak to things more as we move forward, but appreciate the information presented. And again, yeah, if anyone has questions for Maggie, please go ahead. All right, I'm not seeing any hands. I'm not hearing anyone. Again, you know, I think this just provides the continued context as we're looking through what are the consumer issues that are common, that are experienced through our consumer testing. I think marketing especially has learned a lot about the consumer experience. So, we'll keep this information here if you guys have more questions, but we'll also be incorporating this in our discussions moving forward. So thanks again, Maggie. We can go ahead and just take the last 10 minutes and move into final discussion before we wrap up. I thought that we could really just pick up where we left off from the prior meeting. But just given that I think we've had a pretty robust discussion working through the Get an Estimate tool together, I'll share on this slide some of the comments that we received last meeting. We've gotten a lot of really good feedback at this meeting. So I'm going to just go ahead for the last 10 minutes, open up the floor from Maggie's presentation, from the information we represented, from all that we just walked through with the plan shopping tool, opening it up. If there are any final comments, this is kind of we've seen these first two meetings as a little bit of priority setting from the work group and thinking through some main focus areas that you guys have experienced with consumers or directly. I think we've gotten a lot of really good information to start, but again, in these last couple minutes, do we have any final thoughts or comments? Tom, go ahead.
Yeah, I was just wondering, in the prior presentation, there was the mention of 16,500 members that could have qualified for a silver 87 CSR plan and elected a different plan. Do we have any more details about those members? Did they pick the plan on their own? Were they assisted? Do we know any experience of what happened to those members throughout the year and what their medical costs ended up being for that year, to better understand if maybe they did pick the right plan, maybe they didn't have any, accident or unexpected illness?
Yeah, good question. I don't think we have, I'm not sure if we'd be able to connect those different data points, like how many people enrolled in that plan versus what their healthcare usage was, just trying to get at, like, maybe they did, right, to your point, did they maybe choose the right plan for them? That figure really highlighted that, maybe the bronze plan worked fine for a lot of those consumers, but at the end of the day, they still did qualify for a higher value plan that was free or nearly free. And so just trying to get at, even if a bronze plan works for them, why aren't they choosing the higher? I also am not sure if we could get information on, again, the healthcare utilization, and just trying to piece that out a little more to your points, Tom, but those are good points. I'm not, does that answer your question?
Yes. And do we know how if those members were self-selecting that plan on their own or not?
Yes, that was, yes. Second part of your question. Thanks for the reminder. I also don't know if we can connect that. We have information on what types of consumer assistance consumers are using. We have their enrollment information, but I don't know if we have the connecting information to show the plan they enrolled in and then how they enrolled in it. But I can look into that, and maybe we can try to suss that out a little more.
Okay, great. Thank you.
Thank you, Tom. I think, Joan, are you next? Yes, Joan, go ahead.
Thanks. Tom, that's a great point. And I would be curious if a majority of this group self-selected the plans, which would indicate to me that they didn't understand the descriptions on the website. So they just opted for something that was less expensive based on what they were thinking, and not understanding an additional eligibility for a silver plan with an additional discount or reduced rates. But I was thinking back on the low, medium, high, rather than asking what a person's current use is, what do you anticipate needing in the next year? So I may not have used a lot of health services, but let's say I know I'm going to need knee surgery. I want to pick a plan that's going to cover me as best possible. So that might be another way to present it, or an additional way to present it. Yeah. Thanks.
Yeah. No, thank you, Joan. I think that's a great suggestion. I think it's pretty clear that we'll discuss that more. You guys have brought up a lot of great points about that. So we will make sure that that's a part of our discussion. If not the next meeting, then the meeting afterwards. But Joan, I think I appreciate the initial kind of thinking through that and how we work through that. Robin, go ahead. Oh, Robin, do you still have your hand raised?
Yep. Just for next time, just curious if there's like a chat bot or some interactive tool or something that consumers can know they can reach out if and probably when they get stuck.
Yeah, There is, we do have a chat bot. There's been some pretty recent and extensive updates to our IT and our chat bot. So if you guys are interested in, maybe we could have someone pulled in for the next meeting to talk about that more. But yes, we do have a chat bot, and we've updated it a lot in the last, I think, couple months.
And also within the application, Amelia, there's a chat too. The chat feature within the application, I think, is slightly different because it answers more specific questions, like when you're going through, for instance, estimating your household or something.
That's a good point. Yeah, thanks. And then I guess what we'd be focused on is the chat box that's just on the consumer page and available when they're just doing the initial plan shopping before the application. Is that right, Maggie?
I just think that they're slightly, I mean, they're just slightly different because I think people ask different questions. So maybe they're just like, their little brain knowledge is filled with different things. Because it's based on, like, for example, when you're just on the front end of the website, which just tells you about Maryland Health Connection, and you're not actually giving them any personal information to enroll yet. That basically just calls all the information that's on that website. So if you ask a question about, Medicaid or private plans or whatever, it pops up information that's listed on that website. Whereas when you're in the application, my understanding is that it gives more kind of like the tooltip information that's specific to enrolling.
Thank you. That's helpful to understand more. I'll make sure we'll provide a little more information at the next meeting. We'll go into our chat box too, and just the features available to consumers when they're plan shopping. Thanks for bringing that up. Whoever has their hand raised next. Sorry, I'm toggling a little bit, but if your hand's raised, feel free to go ahead. We have a couple more minutes, so we'll take a couple more comments before we wrap up.
Sure, I'll jump in. Apologies I was late to join, but curious if there was any follow-up from the discussion last week regarding Maryland's preferred consumer enrollment channel, whether that be all online by themselves, working with a broker, using the chatbot. Because I know looking at the UI, there necessarily wasn't always a number on the screen for the consumer to call if they got stuck. Would love to explore more of the chatbot functionality, whether that's English and Spanish, and just kind of better understand Maryland's strategy for this OEP to have enrollments, like what you guys are funneling consumers to use as the preferred method.
Sure. Yeah. Well, I'll definitely provide more information on that at the next meeting. And then Steve, I did find a slide on enrollment by types of consumer assisters. So there is a little bit of data on that. It's in the more beginning of the presentation, which I'll send out after this meeting, but I did give a little bit more information on that, and we'll share it.
That's great. Thank you.
Then maybe we'll close out with Diana, last comment.
Thank you. I think my question is about the capabilities that we have in updating the website. Like what are, I guess, what are our limits in terms of things that we could ask to be changed? I think so. When we were talking about the low, medium, high usage, what came to mind for me was whether there would be a way for us to, have check boxes for folks. Like, do you have any of these common chronic conditions or things like that? Because, some folks, they just may not think about it, as something that they have or that they want to get taken care of. And then whether that can impact, the calculations for like whether they fit in low, medium, or high usage. So I'm just curious about technological limitations.
Yeah, it's a good point to make. We'll try to keep our conversations focused. If something is just simply infeasible that we're diving into, I'll either try to keep a tab on it, or we have other MHB staff on this call that can. Hopefully our conversations will, some of them are, a lot of what we'll be discussing is longer term solutions, things that, we may not be able to really consider in the short term, but we'll keep that in mind of kind of thinking through what's feasible, what's a shorter term solution, what's kind of a larger change, and organize our recommendations based on that. But it's a good point, Diana.
Thank you.
All right, again, just want to respect time. I know we've been going up to the limit, but it is 1:47, so I will end this discussion here. There are a lot of comments that I just think we don't have time to read through, but we send out minutes and all of the comments in the chat are included. I'm sorry to miss them. I know we just ran out of time again, but we'll make sure that those comments are included. And I will, if there's any follow-up needed in the chat, I'll make sure to do so at the next meeting as well. So next steps really quickly, won't go through this, but just wanted to announce at this meeting, for the next meeting, we have changed the time slightly we'll meet Tuesday, August 27th instead of Wednesday, August 28th. So just wanted to let you guys know that now. I will send an updated calendar invite right after this meeting. But just letting you guys know our third meeting, we've slightly updated the date and time. So we'll be meeting next on Tuesday, August 27th. I think probably don't have any public comment. We'll give a second if anyone has any public comment, not a work group member. With that, we can go ahead and conclude. So we'll see you all on the 27th. Thanks again for the great discussion, and look forward to seeing you in a couple weeks.
Thanks, Amelia.
Thank you.
Thank you.